Are you ready to take control of your physical, emotional, spiritual, professional, and financial health? Are you ready to experience great success in your life? Each week, join Dr. Diane A. Thompson and her guests for tools and strategies to help you take control of your health and inspire you to live your best life. Now here is your host, Dr. Diane A. Thompson.
Welcome to Health Talk with Dr. Diane, MD. This is a show that is designed to inform and inspire you to a healthier lifestyle. I am your host, Diane A. Thompson, MD, and as always, it is my pleasure spending time with you on this broadcast with a goal that perhaps you may learn something new that could take your health and your life to a higher level. As always, I will remind you that the information heard on this broadcast is for educational purposes only. It is not intended for diagnosis or treatment, so please seek the advice of your healthcare provider before making any changes to your health. All right, so I'd like to thank you for joining me again this week. Today, we will be talking about multiple sclerosis, and we'll be looking at one woman's unique way of fighting the disease and getting herself back to good health. This will be a two-part interview, so you will hear the first part this week, and next week you will follow us for the second part, so make sure you join us for both. So a little bit about multiple sclerosis, or MS as we often call it. This is a disease in which the body attacks itself and forms plaques along the covering of the nerves in the brain and the spinal cord. We need an intact covering in order for good nerve conduction. So when we have these plaques, we have impaired conduction, and the patient may have neurological symptoms. Patients may present with a variety of symptoms such as fatigue and weakness, urinary symptoms, changes in sensation, visual changes, problems with memory and thinking, just to name a few. And some patients may end up in a wheelchair or may become totally dependent on others for care. There are various types of MS, and although we don't know the exact cause, we've often heard theories such as genetics or environmental or viruses. And most people are treated with medications, and this may improve some of their symptoms. Some patients don't do as well with some of these medications. Well, on today's show, we will highlight the story of one woman who happens to be a physician who was diagnosed with MS, and she used a different approach to manage her disease. So we're actually going to take a short break, and when we come back, we will be talking with Dr. Terry Wahls, the author of the Wahls Protocol, and we're going to hear her inspiring story. So we'll take a short break, and we will be right back.
You're listening to Health Talk with Dr. Diane, MD, sponsored by FMG Radio. Please visit Dr. Diane and browse her past shows and guest bios at fmgradio.com/Dr. Diane, MD. That's DRDIANE, MD.
All right, welcome back. My guest today is Dr. Terry Wahls. And Dr. Wahls is a physician and clinical professor of medicine at the University of Iowa. She's also a patient with secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years. She then changed her diet using the Wahls Protocol and the Wahls Paleo Diet, which she says restored her health, and now she pedals her bike 5 miles per day to work. I mean, this is such an amazing story. Many of you may have seen her story on the TED Talk, which I think up to date has over more than 1.6 million views. And so, Dr. Wahls, welcome to the show.
Oh, thank you for having me.
Well, I mentioned that you are a physician. Can you tell us a little bit more about your professional background?
Sure. So I am an internal medicine physician here at the University of Iowa. I teach residents in primary care clinics, in a traumatic brain injury clinic, and a therapeutic lifestyle clinic. I also do clinical research, and I had been researching diagnostic error, but after my transformation, I have changed my clinical focus, and now I'm testing the impact of a paleo diet to treat progressive MS. We're writing grants now to use this for fibromyalgia, and I'm talking to other researchers about using my protocol in other disease states like Parkinson's and obesity.
Now, you were diagnosed with multiple sclerosis, and many of us know that people who have had this diagnosis, they go through symptoms. It takes a while for someone to actually diagnose them with it. So I wonder if you can share with us the timeline. When did you start having symptoms, and what did you present with?
So I was diagnosed in 2000. At that time, I had presented with weakness in my left leg and stumbling. 13 years earlier, I'd had an episode of visual dimming, which had been worked up and no clear explanation. And for the prior 17 years, I'd had episodes of electrical-like pain involving my face, which, again, no one had sorted out the reasons for that. When I had my evaluation, I had an MRI of my spinal cord and brain, which showed lesions at the level of my spinal cord, at the level of my neck. My spinal tap showed a number of oligobands, or abnormal proteins. The blood work was all negative. And so my physicians diagnosed multiple sclerosis on the basis of lesions separated by time, 13 and 17 years, and space, the visual problems and the problems in the leg. I went and got a second opinion from one of the internationally recognized best MS centers in the world, the Cleveland Clinic, and they looked everything over and said, yes, you have relapsing remitting MS. And I started Copaxone, and I stayed with them. 3 years later, they told me my disease had transitioned to the secondary progressive phase, and that's where there's no more improvement anymore. You can only expect decline, and the goal is to try and arrest the decline if you can. They made it very clear that functions once lost would be gone forever. So at that time, I went on mitoxantrone, and then I went on Tysabri, which, by the way, cost $40,000 a year, and then switched from Tysabri to Cellcept. And when I hit the tilt-recline wheelchair, it was very clear to me that conventional medicine, taking the best, latest drugs from the very best people in the country, was not stopping the trajectory of becoming progressively more and more disabled and likely facing a bedridden life. And that's when I decided to begin reading the mouse studies myself, and I began my first rounds of self-experimentation probably about 2004.
Now, in terms of your function, and you mentioned that you were in a wheelchair for several years.
Correct.
And
Yep.
You did not expect to really improve these functions that you had already lost.
Absolutely not. My experience had been for 7 years a steady decline despite therapy. Based on my reading from the mouse studies, I had identified some vitamins and supplements, which I took. And then after 6 months, 3 or 4 months, I got disgusted. I thought I was wasting my money, and I stopped. And then I was even more exhausted, couldn't get out of bed. A couple of days later, my spouse came in, brought the vitamins, and said, honey, I think I ought to take these again. I took them. And the next day I felt better, went back to work, and thought, wow, that was really interesting. So 2 weeks later, I tried the same thing. And again, I was even more exhausted without my vitamins, couldn't get to work. And so now I was very exhilarated. Based on my reading, I was finding things out that were helpful to me that my physicians didn't know. So that really encouraged me to spend more time reading the basic science. It offered more hope that, maybe I couldn't stop the disease, but I could slow down the decline. So with my extra vitamins and supplements, I certainly felt like I was slowing the speed of my decline down, but I was still declining. The summer of 2007, my muscles were so weak in my belly and back, I could no longer sit in a regular chair for more than 10 or 15 minutes. I had to be in a zero-gravity recliner with my knees about as high as my nose. Using 2 walking sticks, I could walk 25, 50 yards. Otherwise, I was in my tilt-recline wheelchair, the zero-gravity chair, or in bed. I was losing my keys, my phone. That summer I'd gone through 3 phones, I think 2 sets of car keys. I had a detailed notebook I was keeping track of what I needed to do, and I knew that I would likely, in the next few months, have to go out on retirement. And that's when I discovered the 2 big things, neuromuscular electrical stimulation and the Functional Medicine Institute, and I took their course, Neuroprotection, a Functional Medicine Approach. for common and uncommon neurologic syndromes. And that, of course, would change everything.
Now, you mentioned that you did a lot of reading, and, there's a plethora of information out there, especially on the Internet, and some of them are accurate, some are not. And there are people out there who are sort of desperate, looking at other options. What sources of information did you find was very helpful?
I was using PubMed.gov. And so I was reading the basic science, mouse and animal studies. I was scanning the Internet, and so when people would mention new ideas, I would go over to PubMed and see were there any studies that seemed to validate these claims. And if there were, then I would explore that further. And if there weren't, I would dismiss it. And I'd also look at how risky was the intervention. So if it was a very low-risk intervention, I was a little more willing to consider it. The higher the risk, the more solid evidence I needed to see in the science before I would do it.
I work in rehabilitative and regenerative medicine, and we see quite a bit of patients with neurological impairments, yet nutrition is often not a key thing in their management. So in your reading, what were some of the things you were finding with regards to nutrition and multiple sclerosis?
In 2002, when I was still walking around, my neurologist had introduced me to the work of Ashton Embry and Dr. Lauren Cordain. And Cordain had written a book, The Paleo Solution, and advocated a Paleolithic diet as a way to reduce symptoms for MS. So I read through that, the molecular mimicry, leaky gut, gluten sensitivity conversations, and decided after 20 years as a vegetarian that I gradually reintroduced meat back into my diet, took out gluten, dairy, and legumes, and followed this new, vegetables, fruit, meat diet. But I'll tell everyone, I still declined. But I thought the science and the rationale seemed valid, so I was willing to stay with that diet. And sadly, my neurologist, my primary care docs, never talked to me about diet, nutrition, never talked about B12, about the omega-3s, about nutrition that brain cells need to thrive. That was left for me to discover based on my own research and then what I learned from the Institute for Functional Medicine.
So you started making these changes and you started seeing some improvement, but you felt like you were continuing to progress.
Correct.
Okay.
But keep in mind, I was thrilled with slowing my disease down because all of my physicians made it very clear progressive MS is a progressive disease, and so the goal was to slow the loss. And so I felt like, okay, I was doing that as good as could be hoped, and I was thrilled with that, though, of course, I was still looking at becoming bedridden. And the biggest fear was MS pain is a big part of my disease as well. And so I'd get episodes of what's similar to trigeminal neuralgia, this horrific electrical pain that was coming more frequently, was more resistant to therapy. Pain clinic was having a hard time getting it stopped. So by the summer of 2007, though I knew I'd likely become bedridden, my fear was that my MS pain would be stuck on permanently on. And that was actually my greatest anxiety.
Was there certain things that you felt helped that pain nutritionally?
Well, after I discovered functional medicine, and had a deeper understanding of the nutritional needs and redesigned my diet, still using paleo principles, but to maximize the key nutrients, what we've observed is that the frequency, intensity of my pain has dramatically decreased. And now the only things that really seem to trigger the pain is if someone has accidentally introduced gluten into my diet or my meal, and then 48 hours later that pain will turn on, and I'll need a burst of steroids to get it turned off. But the last time that happened to me was 18 months ago.
Wow. Now, one of the things you also mentioned is supplements, and that can be a little bit controversial, because some people will say, get everything from your nutrition. So, first of all, what kind of supplements and how did they help you? Like, what did you feel was different?
early on, I was discovering creatine, carnitine, lipoic acid, B vitamins as support for the mitochondria. And that was quite helpful in slowing the disease progression. Did not lead to recovery. Then when I identified the functional medicine folks, I had a longer list, more sulfur-containing amino acids like taurine, acetylcysteine, a little higher dose in the B vitamins. Again, slows the decline. It's when I reorganized my diet along what I now call the Wahls diet, which is 9 cups of vegetables and berries, and this is for men or very tall women, and I'm 6 foot tall. And so it was 3 cups of green leaves, 3 cups of sulfur-containing vegetables from the cabbage family, onion family, or mushroom family, 3 cups of deeply colored vegetables and berries, protein according to your appetite, and then completely, utterly excluding gluten. So the gluten-containing grains, wheat, rye, barley, and beer, dairy proteins, and egg. And when I did that, magic began to happen. And in 3 months, I'm able to walk using 1 cane between exam rooms and around the hospital. At 6 months, I'm able to get on my bike for the first time in 6 years and pedal around the block. And my family and I were all crying, because we had assumed that would never be back in my life. And then at 9 months, I'm able to do an 18-mile bicycle tour with my family. Again, we're crying at the end, and I realize I'm creating a new future for everybody with MS and progressive MS, because now we can say that it is possible, at least for some people, with diet and lifestyle interventions, to begin to recover and to begin to recover functions that you had thought were lost forever. And so we've been doing clinical trials and testing this, of course, in others.
This is amazing. And what I'm surprised about is you still don't hear a lot of this in the hospital setting. People are still very focused on treating the disease with medications, and you really don't hear too much about dietary changes. So this is really an amazing thing. Now, what about exercise? How did this factor in your lifestyle? I know that for some MS patients, it can worsen things. They can get a little overheated, become more fatigued. How did that work for you?
So, for me, exercise has always been a part of my life. I was physically active on the farm. When I went off to college, I started running and doing taekwondo. I competed nationally in taekwondo, and was still running, skiing, biking, very, very active. At the time I was diagnosed, I knew that physical activity and exercise to keep my muscles as strong and as aerobically fit would maintain my function as long as possible. So every day I got up and I did strength training exercises, and I did walking on the treadmill. When I could no longer do that, I put in a endless pool, which is like a swimmer's treadmill. And so I would swim and lift weights. And I did that every day. Finally, though, in 2007, my coordination was such that I could no longer swim. So I was doing a simple water aerobics that had been organized by my physical therapist and lifting weights. And I started out with 15-pound dumbbells in the very beginning, and I was down to 3-pound dumbbells by the summer of 2007. 3 pounds in my left hand and 5 in my right hand. And I could do about 10 minutes of exercise. If I did 15, I would be so exhausted I'd have to lay on my back for the rest of the day, and I couldn't go to work. Now, in retrospect, the thing that I should have done more of was I didn't stretch as much as I should have, so I have to spend a lot more time stretching now. But exercise is very, very key to maintaining one's strength, whatever your health conditions are, for as long as possible.
I totally agree. Well, what we will do is we will end part 1 of our interview today, and we'll come back for part 2. In part 2, Dr. Terry Wahls will talk about her book, The Wahls Protocol. We'll also learn we learned some of it just now, but a little bit more about this protocol and how she used it to regain her health, and look at how she's actually doing today, and talk a little bit more about her clinical research that she's involved with. So make sure you join us for part 2 next week. Remember, as I often tell you, your health is your wealth. So please do something healthy for yourself. And we will see you again on the broadcast next week to continue this wonderful, inspirational conversation with Dr. Terry Wahls. Take care, everyone.
You've been listening to Health Talk with Dr. Diane, MD. For show replays and full guest bios, please be sure to visit fmgradio.com/Dr. Diane, MD. That's DRDIANE, MD.